I would like to thank Ms. Bako Angelic. I'm responsible. I made a mistake. The photos are actually photos of a Brazilian photographer who was happy to share these photos with us. We got the contacts of this photographer through our guests. So we were never in such a luxurious hotel before. That's because this is the only space which is fully accessible for persons with disabilities and that can at the same time receive a large number of people in the whole city of Zagreb. So I think this is an important message for all of us, that we need to work on adapting the premises for them to be easily accessible for persons with disabilities. Whenever we need a support, we are always supported by the UNICEF's office in Croatia as a donor and a partner on this conference. And we can really say we are UNICEF's partner, and we have been so for many years in Croatia. It's a good sign for RODA that it's on a good track, and that UNICEF is on the good track as well, because we think exactly alike. We'll be greeted by Đurđica Ivković, who is the program coordinator of UNICEF Croatia.
Good day to you all. First of all, warm greetings and welcome to the conference. I must say that the change has begun. Even though we are in a hotel, this change is a step forward. This is the first of the 10 years of RODA's conferences that is talking about women with disabilities, and I think that this is an obvious proof or evidence that change has taken place. So, without further ado, I would also like to say that in addition to RODA, which has consistently since its establishment and for the past 10 years through its annual conferences or milk conferences, has always talked about and presented to the public topics that not many organizations talk about or deal with. In fact, these are topics that are sometimes either controversial or are even considered as taboos in our society. And these topics that RODA talk about spur a lot of controversies because people do not discuss them. And these issues concern the most vulnerable groups of our society. In addition to RODA, who organized this group, I'm glad to see that the Ministry of Family, the Ministry of Health, and the city of Zagreb have all gotten together to organize our conference today. So with their contribution, they have put in an effort to provide more assistance to assuring better access for persons with disabilities, especially for caring for mothers with disabilities. And we're only at the very start of this process. But it's important that we're in it together so as to be as efficient as possible. As an encouragement to quicker establishment of support to women with disabilities during pregnancy, in order to provide that support with the Ministry of Health, we met last year, and finally, after dealing with some issues for years, we started talking about an initiative called the Maternity Wards Friends of Children and Mothers. And last year, the ministry formed a working group which adopted a basic action plan. So basically they have a plan, a strategy on how to implement this new big plan for Croatia. We have 10 big new steps of this initiative, and we have a training plan. Since the beginning of this year, we started implementing the training of healthcare professionals in 4 maternity wards or maternity units who applied for or registered for this project called Mother and Baby Friendly Hospitals. It's very important that we do not discriminate against especially vulnerable groups of children, but this also includes women with disabilities. Thus, in the implementation of the mother and baby-friendly hospitals project, it's very important to provide the necessary training to start questioning our own practices in the healthcare system. And I think that this is the best and most efficient way to provide the most efficient healthcare and the best healthcare to women with disabilities. So once again, I am very happy to be with you here, to be working with you on this. And I am glad to see that change has started. We hope that change has started occurring in these 4 maternity wards. Like I said, we have yet to see the results of this change. Major steps have been made, and I would like to use this opportunity to congratulate you for the past 10 years of hard work and for organizing these conferences for the past 10 years. I wish us all to quickly reach what is a civilizational norm, and that is a non-discriminate experience for every woman during childbirth. Thank you.